I'm very thankful to you to come and accept our invitation to start this course as a course director. It's your idea that to develop something in the Asia-Pacific region, and I'm sure this first Asia-Pacific vascular interventional course would be the beginning of a very big course in this area, because now the peripheral vascular disease is not only confined to limbs, it's now distributed right from head to toe, and it will encompass procedures right from intracranial angioplasties, carotid angioplasties, treatment of aortic aneurysms and dissections, a lot of embolizations which would be helpful in treating venous and arterial malformations. Also, it will take care of the limb ischemias, preventing amputations, and treating deep vein thrombosis, treating lasers, varicose veins by laser, doing intra-arterial and intravenous lysis, embolizing bleeders for in the gastrointestinal tract, in the pulmonary tree. So it's a huge canvas of interventions which we can do as interventional cardiologists. And now this is the in thing, and that's why we want the cardiologist, radiologist and vascular surgeons to come together and join hands and develop this course as the best and the teaching course in the whole of Asia-Pacific region. Now we are very fortunate that Dr. Michel Henry is the course director, because he is the father of peripheral vascular interventions in the whole of world. And he's trained thousands of interventional cardiologists at France and also at different places all over the world. And with his guidance and with his leadership, this course is definitely going to be one of the best courses in the Asia-Pacific region. Next year, we want to have this course for 3 days on the 3rd, 4th and 5th of April 2010. And this course would have many live cases from India and also abroad. And it will be demonstrating newer techniques from India and also from abroad, and this will be probably attended by at least 1,000 people next year. This is our plan, and this year what we plan is that we have didactic interactive sessions based on field presentations, especially confined to aortic disease, arch vessel disease, venous interventions, peripheral vascular disease, and also basic topics concerning cath lab safety, radiation safety, contrast-induced nephropathy, and epidemiology of vascular disease. It will also have a session for the vascular surgeons at the end, and in the end we will have a hands-on workshop which will include training of interventional cardiologists, radiologists, and vascular surgeons on simulators for peripheral angioplasties, for carotid angioplasties, for IVC filters, renal angioplasties, etc., and also on the animals in the cath lab. It will also have a duplex scanning hands-on workshop and an image interpretation workshop. In broad, this is the outlay of the course, and I'm sure this course would continue to be very interesting to the audience, and we'll have much more participation in future also. Dr. Henry.
Okay, it's a very good program. I think it's important to have a large program like that, because peripheral vascular disease, as you said, it's not only artery but also vein, also pulmonary vein, and we have a lot of technique now which are in relation with surgery. And we have to say that surgery is not the past. We need surgeon, but surgeon, they have to be trained in interventional procedure, because interventional procedure, that's the future, but we can't treat anybody with interventional procedure, and sometimes we need also surgery. So it is important to have with us vascular surgeon, well-trained vascular surgeon. But we need also radiologists, because we need good imaging. Good imaging, that means duplex scan, CT scan, MRI. So it's important to have with us radiologists, interventional radiologists, because radiologists can do interventional procedure, but for radiologists it's important to give us good imaging. And for a surgeon, it's important also that a surgeon should be well trained in interventional procedure, but also in surgery, because we need surgery, maybe less now. Because with interventional procedure, we could say that normally we could treat 80–90% of the patient at first intention, but with some patients, sometimes it's impossible to do interventional procedure. We may have also complications, so we need surgeons. That means that we should be a team with vascular surgeon, radiologist, cardiologist, nephrologist, diabetologist, because it's important to have all these specialties with us. Do you think so, Dr. Kala?
I definitely think so, and it's probably now we are sort of moving out of the turf war between the cardiologist, radiologist and vascular surgeons, and it's not only the three of us but also the pulmonologist, the general surgeons, the orthopedic surgeons, the diabetologists, who come together and form a team, and all of us can then definitely make a difference in the incidence and treatment of peripheral vascular disease in the whole of Southeast Asia and the world. And we hope that this course would be very good. We invite you to join this course and to give your suggestions so that we can make it better next year and in subsequent years. Thank you.
Thank you.